Well, we're going to have a little side chat here with Dr. Steven Shaya, and we are very aware that we're the last ones before lunch. So bear with us, but hopefully the exciting thing about this is that we're just about close enough to be able to break and be able to talk to each other and mingle a little bit more. And Dr. Shaya, I really want to take a step back, for the benefit of everybody here, to really hear the beautiful journey and the beautiful story of your family that went from being a migrant family to building a phenomenal family of healthcare companies that are touching the lives of hundreds of millions of people across the United States and globally, and everything that you're doing with your family office. But before we get into some of the programs that you're working on, I would really want you to tell us a little bit of that journey because it's a journey of creating an entity anchored on values and anchored on a higher purpose. So please share a little bit of your background and your story for us and your family.
Well, first of all, I wanted to thank Enrique and Steven and Carlos, and I especially wanted to thank my mother. I'm not allowed to leave the office unless it's something really important. So, Mom, I love you. I hope someone's recording this, and thank you. Um, so, a little bit about our journey. I'll start with my grandmother, my maternal grandmother. She had 12 children. When number 12 was in utero, her husband passed away from a hunting accident, and she raised all 12 on her own, which always amazes me. I have 3 children, and I'm suck and win quite often. So uh, to support her family in a enclave in the northern part of Iraq, she used to deliver babies. She was a midwife. And we're Iraqi Christians or Chaldean, and she delivered thousands and thousands of babies. And it didn't matter if you were Muslim or Jewish or Christian. She was like the mayor of the town. She's delivered everyone's babies. And it's a little surreal when I run into people and say, your grandmother delivered me. Uh, she brought all 12 children to the United States. And the thing I always remember about my grandmother was she had such a servant's heart. She had so much joy in giving. You know, givers are happier. And she never had much materially, but she had a richness that you cannot buy. And so that's something, if you want to think of my grandmother, think of a quote from Mother Teresa. Not all of us can do big things, but we can do small things with great love. That was my grandmother. My father came here from Iraq in 1967 under difficult duress. He was a physician in Iraq, and when he came here, because of the circumstances, he had to start from scratch. He had to do all his training over again. The day he got off the plane, he got 4 jobs. He met my mother, started to have a family, went to University of Michigan, and my father never complained. He was one of these people that he had a clear sense of what was important. It was faith, it was family, and it was everything else. And um, and so he owned a medical lab. He sold the medical lab in 1996. He was retired for about 5 weeks, and my mother said, you really need to go do something. So his retirement was to start a company named J&B Medical. Um, the reason why it was called J&B was my brother Julian had very difficult health circumstances when he was younger, and he was miraculously healed. And my grandfather is named Bashir, and we love my grandfather. My middle name's Bashir, so I call it J&B. Now, I was in Kentucky a few years ago, and I said, I'm with J&B, and everyone got super excited. They thought we're the Scotch whiskey. And I was very sad to have to disappoint them and tell them we were not that good. Um, Today, we have 19 different business enterprises. We run the gamut from medical distribution, where we sell everything that goes in a hospital, pharmacy, physician's office, supply equipment, pharmaceuticals, to specialty businesses like EMS, animal health. We're the first company to tie animal health and human health because people that have animals, they live longer, they have better quality of life, better clinical outcomes. So that's a company, it's going to be a multi-billion-dollar company for us. We're going to take it public within 3 years. But our claim to fame is we're one of the largest third-party billers of consumable medical products to the homes in the United States: diabetic supplies, wound care, ostomy, insulin pumps, continuous glucose monitors. We reach 260 million covered lives on the medical side. We reach 170 million covered lives on the pharmacy side. We have a telemedicine, telehealth company. We do virtual visits around the world: mental health, behavioral health, substance abuse, social determinants of health. We reach 1.2 million people today. We're in 49 states. We're in 28 countries. It is a family business. I get fired quite regularly. Um, Fortunately, I have 3 grandchildren from my mother, so a little job security on most but not all occasions. Many people ask me because they try to put J&B into a certain bucket. And I say the best way I like to describe J&B, it's a platform of purpose and possibilities. Oh, thank you. Thank you, thank you, thank you. But we've been on this 28-year journey of going from a products company to a best-in-class provider of products and services to homes to now a population health company. So it's been quite a journey. I definitely have more scars than stars, but every failure set us up for success. And through the family office, we're going to invest $2.5 billion in the next 5 years in a variety of different healthcare infrastructure. I think during this journey, you find out who you are. Our meaning, our purpose is to make healthcare as affordable and accessible to as many people globally as we can. That's what God called us to do. We're stewards of the blessings, and so J&B is really, my father died 3 years ago, so there's a lot of legends in the cemetery, very few legacies. J&B is my father's legacy, it's my grandmother's legacy, and it's always an honor to be able to share.
I think we could just stop there, but we're not. We're gonna keep on going, and we're gonna go from this big, backstory. But the reason why I love this story is because it is a story of a family that really built something guided by purpose from the ground up, and now touches hundreds of millions of lives. And I want to go into one aspect of the way you guys do what you do, which to me is very special. You don't just stop at doing the job that gets you paid. You try to really impact the communities while doing so. For example, many times you get government contracts that tells you, hey, can you please help us take care of this particular community? And you don't just deliver the service, the goods, that you're compensated for. You actually try to penetrate that community and make them part of the equation. I want you to tell everybody here a little bit about the work you have been doing with the Navajo Indian communities, and how beyond servicing them, you co-create with them. So please, share us a little bit about that story.
Thank you. And I think Tamara wanted an opportunity with the Navajo, so right on cue. Uh, So my mentor is a gentleman named Major General Elder Granger. He's a 2-star general. He's a hematologist, oncologist. And he always used to talk to me about the importance of relationships. And we have, because he shared the 5 ships, we call them: relationship, fellowship, friendship, partnership, discipleship. So I know we were talking about transformational, which I love, by the way. I love. We look at it a little differently. And so the relationships, we wanted partnership, discipleship level type of relationships. That's how we look at it. So there's depth to it. There's meaning to it. And the other part of that is, and I saw Rick here, so we always talk about a Jewish scholar named Maimonides. And Maimonides, he talked about something called tzedakah, which is the different levels of charity. And the highest level of charity, the highest level of giving, was to form partnerships and get people out of dependence. They didn't have to depend on your charity. That's the highest level. So we think of it in those terms. So with the Navajo Indians, first of all, you have to look at it and say there's something called cultural health. Okay, so different communities, underserved, underprivileged communities, there's different languages, there's different perspectives, there's different customs, there's different beliefs. So you have to take time to understand. I think Doc was talking about trust. Well, everything moves at the speed of trust. Stephen Covey wrote a book, great book. You want to change the world? It moves at the speed of trust. We have to focus on building trust with all the key stakeholders, then you can change things. So with the Navajo Indians, we formed a partnership with them. And the partnership is in New Mexico, we have a joint venture with them. Now, the joint venture is the Navajo Indians. It's a workforce development program. So we're actually training them to take care of their own. There's 400,000 Navajo Indians in Utah, New Mexico, and Arizona. And by the way, it's very interesting because there's 9.7 million Native American Indians in the United States. About 3.6 million are what they call federally registered tribes. The Navajo is the strictest. They have something called a blood quantum. So 25% of your blood has to be Navajo. Otherwise, you're not considered Navajo. There's a lot of like the Cherokees. It's a lot more loose. But anyway, we formed this partnership with them, and underserved, underprivileged populations, when they're taken care of by their own, they do better. They do better because there's certain cultural nuances. So we've developed this workforce development program where they're actually J&B out in New Mexico, Utah, and Arizona. But then the second part of it is, it's not just, people talk about different things. We have to be careful because we use certain words and people put a political lens on them. So there's scarcity and abundance. Scarcity means that, if I have something, someone has less of it. That's how the vast majority of the world think. We think in terms of abundance. The more we give, the more we get back. So what we're doing with the Navajos is we're creating a partnership, and that's going to be a multi-billion-dollar entity for the Navajo tribe, where they can create wealth and opportunities for their own. And I think that's important. A lot of people talk about, okay, I'm going to give money here. I'm going to do this. It's like a big checkbox. But there's no meaning. There's no intention behind it. Our intention, going back to Maimonides, is to get people out of dependency and to create opportunities for people. So we think of it in those terms, in that lens. It's something we're very proud of. And quite frankly, as you get to know the Navajos more and more, there's just a lot of background in history, and it's humbling to realize that many times in history, it wasn't our finest moment in dealing with the Indian tribes. You can go back and read the Trail of Tears, and when you start understanding where people are coming from, it's pretty humbling. I will say this: one of the first Indian tribe people I met was someone named Wilma Mankiller. So I was a little intimidated from minute one. I was like, man, I got a lot to learn here.
I love that story because the truth is the job could have stopped at, hey, we have a contract to deliver goods and services. Let us just do it with our current structure that already does it in across many states and globally. But no, let's co-create and let's help them take autonomy and being empowered to also be part of their own community health and progress. So love that story, and I know it doesn't stop there. I believe there is also the same formula and framework has been applied also with the veteran community as well. Can you share a little bit of that?
So 38% of people that leave military service are unemployed. And I could never get my arms around it. How is that possible? But then it finally hit me one day. If you're a person and you're used to a lot of structure, someone tells you where to go, what to do, when to eat, then when you lose that structure, you struggle. And so 38% of people that leave military service are unemployed. So we set up a partnership with an entity in Atlanta, Georgia called Bobby Dodd. We have 103 service-disabled veterans today that work for us. They are amongst our most productive, most amazing employees. We have about 2,000 employees today. And so what we found is, how do we share their story? Because everyone's journey is special. Everyone's journey is unique. So how do we share? So now when our patients, there's a barcode you could scan, and it tells you who answered your call, and it gives their story. It tells who packed your box. It shares the story. We're, to your point earlier, we're too transactional. We're divine beings on a human journey. We got to put human back in humanity. We got to put care back in healthcare. And so, and it's just amazing. And every time I go there, I end up in tears because you hear these stories, how these people were living in their cars or they were homeless, and they served our country. They risked their lives for us. And yet we kind of forget about folks. And we all have a responsibility. Healthcare is not a political football. It is not a political football. Everyone should have access to basic healthcare. Now, we may differ on how that is done. but that cannot be questioned. Everyone has to have access to basic health care. When you give people health, you give them hope. And when you give them hope, you give them everything. We can never forget that.
Wow. So we just talked a lot about how these intentions to do good for society eventually lead into ideas, but the most beautiful part is that they follow through with execution. So part of the effort of continuing to have this is as this sparks intentionality and as you see and get motivated by others and what others are doing, that is going to motivate and it's going to create intentionality within your organizations. But let those ideas also be inspired by those ideas so that then you can follow through with the execution. I want to switch it up a little bit. I want to talk about data. We've talked about the importance of the social determinants of health and recognizing that to really be able to change systematic, healthcare outcomes, we need to go beyond, healthcare itself, and we need to really look at the other 80%. And SDOH factors are a priority. What do you think the role of data plays in being able to really help us as a society, whether it's the private sector or the public sector, to continue to be able to move the needle for these communities? And what do you think is some of the challenges we face to be able to get SDOH data right now?
So 20% of health is actually medical care. So if you take genetics, you take the environment, you take your behaviors, that's the other 80% of it. So you go to places, and I'm sure many people in this room are familiar, you go to places in Dallas. So if you take, what's the number one predictor for healthcare? Your zip code. Your zip code. It's not your blood pressure, it's not your blood sugar, it's your zip code. So you can be in Dallas, and if you live in this zip code, your average life expectancy is 67. If you live in this zip code, you're 85. Same thing in places like Louisville, Chicago, all these big cities. So more and more, I think people are starting to recognize that the social determinants of health are a big factor. The challenge has been the incentives haven't always aligned with these programs. So now the federal government has started a program called In Lieu of Services, where Medicaid programs can apply for a waiver, and 5% of the total Medicaid spent can go into certain things like transportation, food, financial. So more and more, there's an advent of those programs. But here's the challenge. Everyone that tries to do those programs, it's hard to do it as a one-off. It's very hard to do it. They try to build the vertical as a one-off. People raise $1 gazillion. It's not viable. So my late father always used to say, no margin, no mission. Don't come to me with something, and it could have the best impact in the world, but it's gotta be sustaining. And I'm like, okay, Dad, thanks. So the one area where I think that shows the most promise is food, as our prior guest said. The challenge is, again, no margin, no mission. So the opportunities that we have, because we take care of large populations of patients, and through value-based care, we have a bucket of money, we can weave it in to our whole bucket. So we can make the model work, because if you just have it as a standalone, it's very difficult to work. I'd love to talk to you more, but it's very difficult to work, and you're constantly depending on philanthropy and funding. And so for us, we look at these things and say, you know what innovation really is in healthcare? It's integration. How do you weave it into something that is sustainable and scalable? And everything we do, we try to, and forgive me, I hope this doesn't sound arrogant, but we try to build multi-billion-dollar businesses out of it. So that's one on and that. So I'll give you an example. So social determinants of health. So Michigan now has new requirements for social determinants of health. So 16% of your population in Medicaid has to get something called a Z code. So that the payers have to screen out and get a Z code. The challenge is it's hard to get the Z code, but now the financial incentives are combining with getting these Z codes. So they do a screening test, and they'll say you have housing challenges, you have financial, food. But if you don't, this $2.1 billion health plan, to give you a real-life example, 5% of their clawback is based on getting the Z codes. I mean, it's in large measure. So that's $100 million. Where I come from, that's a lot of hummus. Okay, so So what? So we've developed a program. They tried to do it internally. They didn't. It didn't work. They tried to hire third parties. Didn't work. But what we found out is if we did the screenings. We could get the information because people wanted to also get their drugs from us. They wanted to get the supplies from us. So internally, if they did it, they were getting a 1% engagement. To have a third party, they're getting 3 to 4%. They needed to get 16%. So on 560,000 lives, that's 87,500 people that you get a Z code for. So they couldn't do it. We have a 40% engagement rate because they need to get other products from us. So we kind of, I don't want to say we have a gun to our head, but we have a captive audience, let's say. So, but again, that could be a whole business in itself. The other one I want to tie in, a lot of people don't talk about mental health as much, but mental health and social determinants of health are really big. It's really personal for me. I had a relative 3 years ago commit suicide. Three young kids, 37 years young, and everywhere I went, it's like the system. There's like it's just not. And I'm like, you know what? I'm tired for waiting for other people to change it. So we started down a path. So we developed our own program where we do screening. So we focused on youth to begin with. So in the state of Colorado, all their school-based clinics from 6 to 12, we're doing all the screenings. So I'll give you some real-life numbers. 30,000 kids we screen. So when they go to the clinic, you do the screening. 1 out of 6 had a plan to commit suicide within 12 months. 1 out of 6, okay? And a lot of other stuff. But with our program, we screen, we diagnose, and we have something called a micro-learning or brief intervention where every day the parents or the caretakers get 5 minutes, of wisdom. The number one factor to mental health is the relationship within the family. That's the number one. So out of those 61% that had a plan to commit suicide, after going through the program, 75% no longer have suicidal ideation. So we're literally saving lives. Now the state of Colorado is going to screen all the kids, not just the kids ago. And we have 3 other states that are coming on board. And we're starting a huge program with a company. They have 4 million employees because they have a big problem with substance abuse. But as part of the social determinants of health, if the number one predictor for scholastic achievement is your mental health, and the number one predictor for lifetime achievement is your academic performance. It all tied in together. And so, I think one lesson that I think we didn't pick up during COVID. We talk about health equity, we talk about disparities. Well, guess what? If we were good in the US, but other people weren't good elsewhere, eventually we weren't going to be good. We have to think in a much broader lens, and we really need to understand that we're all in this together.
Wow. It's such a pleasure every single time that I get to speak with you, Dr. Shaya. Thank you for sharing this inspiration with us. As we get closer to wrap up, I would like to, talk about the future a little bit. Let's think about, if we have the magic wand, and we all know the challenges that we face. I think there's a couple of very good lessons learned that we're getting from you and what you guys have done, which is I love the idea of being able to say, without shame, saying, hey, if there isn't margin, there isn't mission. A lot of the people sitting across this room have jobs that require, to meet KPIs, goals, targets, and at the end of the day, the sustainability to, when you're able to align sustainability with impact, now you can have transformational sustainable change. What do you think the future could look like in the next 5, 10 years? What would you like to see in a framework that says, look, through these partnerships, through these collaborations, what would be the magic wand? Let's kind of brainstorm and riff a little bit here on through your family office and everything that you do. What are the things that you keep an eye out for? What are the things that make you, stay up at night and get excited about?
So U.S. healthcare today is $4.5 trillion. Just to put that in context, that's the 3rd largest economy in the world. In the world. Put that in context. By 2030, it's going to be $6.8 trillion. And if you add food and climate, We're here during Climate Week. It's going to be $11 trillion. Okay, so the thing that keeps me up at night is that in 2023 there was a study by Legatum in London, and they talk about all the different healthcare systems and who has the best overall health. Number one, Singapore. Number two, Japan. Number three, South Korea. US, 68th. Not so good considering how much money we spend. So that's what I just cannot get my arms around. I come from a very humble background. We never wanted to waste. And I see like we spend so much money and we get like so little bang for our buck. And I think a lot of the problem is that people get caught up in the political lens. I mean, honestly, if they didn't call the healthcare reform Obamacare, it would have been one of the great things ever. You know what I mean? But just because he put his name on it, they made it a political thing. We gotta stop that. I'm so sick and tired of going, oh, wait a minute, this is a red state, this is a blue state. Well, guess what? We're all, we're all human beings here, and I'm just, that's the thing that we can't get out of our own way. And so I believe in the public-private partnerships, but I believe the private side's got to lead it, and we have to show that it's not one view, it's not one perspective. Margaret Mead said it best: never doubt that a bunch of thoughtful, committed people can change the world. Indeed, it's the only thing that ever has, and that's what we need to think about.
And with that, I think it's a perfect break to go to lunch. And we hope to talk to you the rest of the day. And thank you for joining us, Dr. Shaya.